So we'll be dealing with the first segment. We'll be dealing with reading part A. Keep smiling. Paracetamol overdose. This was asked by the aspirants. Sash had asked since he is an active member in the platform. I thought of yielding to his request. And that was not completed in the earlier session, it seems. So we'll not be giving details about the introduction. Almost everything about it. If there are beginners, definitely you can watch the episodes 1 to 38. And all beginners, just start watching episode 1 to 38. By then, we'll guide you with the 39, 40th and step by step. There is one instrument which is not muted.
Yes, Father, is Prabharani.
Prabharani, please. If you repeatedly disturb, things will be difficult, okay? Prabharani, are you listening to me? Okay, four texts, text A, text B, text C, and text D, but then one theme, okay? Very often I have seen wrong teachings in many platforms saying there is no connection between text A, B, C, and D. Definitely that's about one single theme. So the link connection between the text is very important for you to do it faster. 20 questions, 15 minutes, which means you have hardly 45 seconds to answer one question. Greatest challenge and enemy is time. Expeditious or fast reading task. Expected grade, always I remind you, is 450 plus, if not 500. And never ever target for 350. If you do that, psychological impact result is that you will end with 340, 330, 320, and 310, those. So OET reading part A, paracetamol overdose. I think this is for the official sample number 2 from the official OET website. Thank you, OET, for allowing me to use this for teaching purpose. So reading part A, if you have gone through my videos earlier sessions, you might have seen I have taught you 12 steps. But as of now, I'll be teaching you in 4 steps. Okay. So, but then those 4 steps include essentially all the 12 steps. But then for clarity purpose, which is useful for both beginners as well as advanced learners, we are putting into 4 steps, okay? And this should be the guideline for you for all the reading part A practices. And if you're a beginner, I suggest you to go back to the recordings where I have repeatedly taught in more than 10 reading part A sessions about 12 steps to be adopted for the beginners to have competency in reading part A so that you can complete in 10 minutes, if not in 7 or 8 minutes. Okay. Step number 1, skim the 4 texts and write down a heading for each text. Text A, 1 heading, text B, 1 heading, text C, 1 heading, text D, 1 heading. That can be anything for you to understand the content. And step 2, read question statements 1 to 20. Okay, all the 1 to 20 questions. Highlight keywords and match with the related text. Means 1 to 7, you are asked to match with the text, say A, B, C, or D. But I suggest you to take second step, go through all the texts, all the questions 1 to 20, and mark to which the passage it belongs. Okay, just by understanding the keywords, not going into the passage now, text now. But then don't think that you are going to do all these things in your exam. No, once you are competent, you don't require anything of these steps or anything. You can just go on answering. That's it. Step 3 is skim the 4 texts and highlight the clues. Okay. Step 2 is skimming the questions to find out the keywords or hedging words. Step 3 is skim the 4 texts. Text A, text B, text C, text D, taking maximum of 20 seconds for your text. Okay. Then text 4, locate the answers in the text 1 to 20. Finished. Reading part A, step 1, skim the 4 texts and write down a heading for each text. Skimming for 4 text headings. First one, text headings given for text A, B, C, and D. Most of the text given to you, there will be a heading for each text. There will be a common heading. For example, today, the main title is paracetamol overdose. Then each text A, text B, text D, C, and D will have separate headings. Today we have. Okay. If we don't have, if not given, read and summarize. If the headings are not given for each text, you have to read and summarize. Selection headings means section headings have to be taken note of. If there are some subheadings, main heading will not be there, but there will be classification types or something of that sort. So look at the section headings and subheadings. I'll show you exactly what are the section headings and subheadings, because today's text we have everything of this sort. Now the third option, if no text headings, section headings and subheadings are given, sometimes, very rarely, no section heading, no text heading, no subheading, just paragraph is given. If at all, what you have to do? Read the topic sentence. Topic sentence, that is normally the first sentence of the text, and you will understand what is the gist of the whole text. Fourth option, if a table is given, look for table, section or column headings. Look for the table, section or column headings. There will be horizontal and vertical columns. There will be some headings just above the columns. Just look for those headings and subheadings, which I will be demonstrating now. Okay, section A. What is the heading? Text A. What is the heading? Paracetamol overdose is the title or the main heading. What is the text heading? Text A.
Paracetamol contraindication and
contraindications and interactions.
And
Yeah. Now, what is the subheadings? What are the subheadings?
Special warnings and
precautions to use.
Interaction with other medical products and other forms of interaction. Now you have all the options given here. Normally you have some headings, some heading for the text. So paracetamol overdose is a common heading title for all the 4 texts. And paracetamol contraindications and interactions is the heading for this particular text. And special warnings and precautions for use and interaction with other medical products and other forms of interaction are the subheadings. Here you have paracetamol contraindications. Contraindications means warnings, and interaction. You have interaction. So this heading is the subtotal, a summary of these subheadings. 4.4, 4.4 and 4.5 summarized into one heading, that is paracetamol contraindications and interactions. So the words are here: warnings, contraindications, interactions, 4.5. So that's how you have to understand. For this, for example, paracetamol contraindication and interactions, this heading for text A is not given. So what you have to do? You have to see the headings here, subheadings, and select the main words as the headings. Okay. Now here, what is the heading? Text heading. This is text B.
Procedure for
acute single overdose.
Overdose. Okay. One second. Yes. Now, text C, paracetamol poisoning, emergency treatment of poisoning. Just to show you for the text together, all the 4 texts. Now, all these 4 texts have their own headings. Sometimes, if at all, some people complain there are no headings. Usually authentic materials most of the time have the heading. If at all you don't have the heading, we'll show you what to be done. Now, this is the first text. Sorry. Is the screen readable?
Yes, Father.
Okay. Now, what you have to do if you are a beginner, make sure that you write down the whole heading first. Okay, what is the heading here? Paracetamol
contraindication and interaction.
Just take a paper, if you have a paper or notebook, just write down this heading. Okay. Then we will summarize it. We will make it shorter. So how can it be understood? Contraindications and interactions. You can understand that way. Right?
Yes, sir.
Now,
Yes, sir.
contraindications means warnings and precautions. Okay. And the interaction with other
medications and products.
yeah, other medicinal products and other forms of interaction. Interaction of what? Interaction of paracetamol. Okay. So contraindication and interaction is the summary of these two subheadings. That's why I said if this main heading is not there, make a heading from here. Maybe you can try to warnings and interactions, whatever. It's only for your convenience purpose, not for the examiner, not for any other purpose, for you to understand. So title is paracetamol overdose. Section heading is paracetamol contraindications and interactions. Subheadings are special warnings and precautions for use and interaction with other medical products and other forms of interaction. So here either you can take it as contraindications, or if you are a beginner, always take contraindications and interactions, because this later portion, second half, speaks about interaction. Whenever there is a keyword connected to these interactions, precautions, warnings, or interaction with other medicines, all these will be from this text A. Hope you understood. Yeah. Now this is a text B, procedure for acute single overdose. So what could be the heading? Procedure.
Procedure.
So whenever there is something speaking about step by step, something maybe speaking about, here you can see acute single overdose. Now hours, 4 to 8 hours, 8 to 24 hours, 24 hours, and all those things, and supportive treatment, anything of that sort appears, you know, they are those questions have answers here. So some people are asking about the tables. When there are tables, usually look at these boxes in the top and these boxes, common boxes at the bottom. They are something like subheadings. Okay. So sorry. So that is procedure, and next one, C. Here, paracetamol poisoning, emergency treatment of poisoning. So what could be the heading? Treatment, right? Paracetamol poisoning, emergency treatment of poisoning. So now treatment they are speaking. This side they have time, hours mentioned. This plasma paracetamol concentration, milligram per liter. These are very important. Okay. So this milligram and this angle. The questions will be based on those headings.
It is black as
And
a screen. Oh,
sorry.
okay. No.
Screen
It was
not
black.
visible.
You know, the screen is empty. It
Yes,
came back.
Is it visible now?
Now okay, Father.
At YouTube, okay. Now clinical assessment. Text D is clinical assessment. What could be the heading?
Clinical assessment.
Clinical assessment.
Yeah, you can make it short also. If you can understand, you can just think of a assessment. Clinical units, albeit everything is clinical, right? So just for your understanding, so beginners always do this, okay? Write down, identify 4 text headings and write down on a piece of paper or notebook. Text A, paracetamol, contraindications and interactions. Text B, procedure for acute single overdose. Text C, paracetamol poisoning, emergency treatment of poisoning. Text D, clinical assessment. And try to visualize what will be there under these headings. Okay. Then what you can do, for your own convenience, you can make them small, like contraindications and interactions, or just contraindications, then procedure, treatment, assessment. Those are the headings which you can look for and write down in a paper, or if you have the material hard copy, you have to write down these 4 headings. Write down on each page of your part, a text booklet and question booklet, all these 4 headings. Here, better in the beginning, you can start as contraindications and interactions, both words you can write. So whenever there is a word connected to interactions or contraindications or warnings, you know that question has the answer here. Okay.
Acha, it is not visible now.
Screen is not there.
Let me just stop sharing and share it again. Okay, last time it was done. Okay. I'll share it again. There is someone who is not muted. Dorothy, please mute. Okay, Deepika, when you interact, you can unmute. Okay. Deepika, are you there? Deepika. See, now I have to go and mute them, so it takes time again. That's the problem. People don't do their duties. Beulah, you have not muted, yes. Yeah. When you interact, please unmute. Okay, no problem. Let's check whether it is working now.
Yes, Father.
Okay, now step 2. Step 1 is clear. Okay, you have headings on each page of your hard copy. If you have hard copy, you can write down. In short, however you can understand. You need not write the full word as well. If you can understand just by contra indications, if you write contra, if you understand, that's cool. Interactions, intra. If you understand, that's better. Only for your understanding. Step 2, read question statements 1 to 20 and highlight the keywords and match each question with the related text. Means you should be able to presume and say from where does it appear. These are the 4 headings: contraindications and interactions, procedure, treatment, assessment. In which text can you find information about the various symptoms of patients who have taken too much paracetamol? What are the hedging words?
Too much.
Symptoms.
Main heading keyword here.
Various
Symptoms.
symptoms.
Various symptoms.
Various symptoms.
Yeah, symptoms, yes. So where it can be? Contraindications, procedure, treatment, assessment.
Clinical assessment.
Assessment, Father.
Okay. Clinical assessment, D. Okay. Till 1 to 7 you require, that is the answer ultimately. Second one, the precise levels of paracetamol in the blood which require urgent intervention. Keyword. Yeah, intervention is the keyword. What is
Urgent
synonym of?
intervention.
Synonym of?
Treatment.
Treatment. Exactly. See how easy. Yes. So all these things can be done within fraction of seconds if you know the keywords, how to identify the keywords. Question 3, the steps to be taken when treating a paracetamol overdose patient. Steps to be taken.
Procedure.
Procedure.
Yeah.
Procedure.
Yeah, steps to be taken means procedure. Always in the procedure you have steps. Yeah, that is B, right? You have to tell me which letter I have to type.
B, Father.
Yes. Okay. Yes. Then 4th question, whether paracetamol overdose was intentional. Intentional. Accidental. Intentional or accident. Where do you have it?
Is A.
Assessment, Father.
Assessment. Yeah. In the assessment you find out whether it was intentional or accidental. Is the person sure the overdose happened? What was the quantity, the quantum of the overdose? Okay. Number 5, the number of products containing paracetamol.
Product.
Number
Number of
Products.
products containing paracetamol.
containing paracetamol. A,
Where
Father.
it can be? A. Yeah, interactions, right? Interactions, right?
Yes, Father.
Yeah, contraindications and interactions. It must be under interactions, I believe. Yes. What to do if there are no details available at the time of the overdose? No details available.
No details.
Where do you take their details?
Assessment.
Yeah. Assessment, right? D. You ask for the details in the assessment, right? Yes. Then 7th one, dealing with paracetamol overdose patients who have not received adequate nutrition. Not received adequate nutrition.
Treatment.
Yeah, you'll be giving additional
C.
IV fluids or something of the treatment, right?
Treatment.
Treatment.
Yeah. C. Yes. That's it. The hedging words till 1 to 7. So you have it here. Yes. All you did predict correct. That's great. Now 8 to 13. 8. If paracetamol is used as a long-term painkiller, what symptom may get worse? Hedging word.
What symptom?
Long-term.
Symptom, long-term painkiller. So where it could be?
Cis.
Long-term painkiller and symptom, Father. It is
Assess.
A.
XTA.
Control.
Is it XTA?
Yes, Father.
The type we'll check out. We'll check out as we go on. 9. Question 9. It may be dangerous to administer paracetamol to a patient with which viral condition? Dangerous.
Contraindication.
Dangerous
Warning.
viral
Contraindication.
condition.
Warning.
Okay.
Yeah.
XTA.
Contraindication. Warning. Yes. Right. Then question 10. What condition may develop in an overdose patient who presents with jaundice?
A.
A.
What condition and with
What condition may develop?
Condition
They're
may
asking
develop.
for a condition, right?
Yes.
They are asking for a condition. Answer will be a condition. Name of a condition. Name will be the answer. So which one?
symptom? D.
C.
Which one? Not clear.
D, Father.
D for the
Assessment.
assessment.
Is it D?
D.
Yeah.
A.
We'll keep in the under warning.
A first.
Okay, it must be A, I believe. Okay, cool. Let's see. Anyhow, 11th one. What condition may develop on the 3rd day after an overdose? 3rd day.
What condition?
Okay, what
also?
condition? They are asking for a condition again, right? Name of a condition.
A for the
B.
intrust.
A. B.
Third day. It also D, Father. The
D.
symptom.
D. It's D.
Which one? You'll have to conclude one.
B.
D, Father.
D. D.
D.
D for no?
Yes.
D.
D.
for dog.
Overdose, no, further. Overdose means it is B, no? B.
Let's keep it. If you have since you have doubts, we'll keep it suspension. Good to have some doubts. So when we go there, we'll find it. What drug can be administered orally within 10 to 12 hours as an alternative to acetylcysteine? Oh, sorry. How do you pronounce
C
it?
for the
How do you pronounce it?
Acetylcysteine.
acetylcysteine.
Acetylcysteine. Okay. Where is it to?
C
How
for
12 to 12 hours?
C. Treatment.
Treatment.
Treatment C. Let's see. Okay. Then 13. What treatment can be used if a single overdose has occurred less than an hour ago? What treatment?
C. Treatment.
Single. Father.
Yeah.
D.
C.
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 Overdose
Treatment.
because it is answer B.
Hmm?
Oh, in B, as overdose,
Answer B.
single overdose.
So you have a doubt. So
C for the treatment.
we'll put it in red since you have a doubt. Okay, and less than an hour ago. An hour ago. So that's also a keyword for you to identify the answer.
Single over.
Single overdose.
Single
B
overdose.
for B. Single overdose.
Yeah.
Yeah, let's see. No, don't worry. Yeah, this one. Sorry, not that one. We have done 13, right? 14th one, right?
Yes, Father.
If a patient has taken metoclopramide alongside paracetamol, this may affect the dash of the paracetamol.
A for
A. A. Interaction. Interaction.
Alongside. Yeah, alongside, which means A.
also.
Yeah, interaction. Yes, yeah. Right. Next. Question 15. After 24 hours, an overdose patient may present with pain in the dash. Pain in the dash means somewhere
Overdose.
in body
D.
parts, right?
D.
Assessment.
D further.
D.
B. Overdose.
D
B.
assessment.
Which one?
D.
D?
Assessment.
B.
D further.
D.
D.
Okay, let's check. 16th one. For the first 24 hours after overdosing, patients may only have such symptoms as, they are asking for a symptom, right? Answer will be a symptom.
Further D.
D.
In D. Yeah.
Assessment.
Okay. 17th one. Oh, I don't get it. Acetyl, how do you pronounce it?
Acetylcysteine.
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 Acetylcysteine, yeah, should be administered to patients with a paracetamol level above the high risk treatment line who are taking any type of dash medication.
C for
A.
Treatment.
C for the
C.
treatment.
Treatment. C.
C. Line.
Some medication, they are speaking about some medicine, right?
C.
Treatment.
Yes. 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 Then 18, a non-high risk patient should be treated for paracetamol poisoning if their paracetamol level is above dash milligrams per liter 8 hours after overdosing.
B. B.
Procedure.
Same
D.
further.
C.
Non-high risk.
The diagram. In C.
C further.
Non-high risk.
C.
Non-high risk and
High risk.
Yeah. C. Yes.
treatment is different.
Then you have hours. If you have seen there, hours was there in C, right? A high risk patient who overdosed dash hours.
C.
Also in C.
Same C
So
further. High risk.
there should be a number as the answer, right? That's why I said you should be looking at the word before and after the space given, dash given. Should be given excellence if their paracetamol level is 25 mg per liter or higher. 25 numbers are important. Okay. Which one?
C.
C.
C further.
C.
C for
Okay, C. 20. If a patient does not require further acetylcysteine, they should be given treatment categorized as dash only.
C.
Categorized treatment.
C
further.
Categorize.
D.
Categorized should be given treatment categorized as dash. Please don't scribble on the
B.
screen. Someone
C
is
further.
scribbling on the screen.
B further.
B for
Bharati, don't scribble on the screen, please. If your kids are around you, please keep the screen away, okay? It takes a lot of time to clean that again. Okay. So if you screen on one screen, it will remain in all the screens. Let me check, okay. Sheba, someone is trying to share their screen. Please don't work on my screen. Yes. Which one is last one?
B or C.
See, now
B,
the
Father.
screen was going good because of
B,
your
Father.
scribblings. Again, the black screen is coming. Which one?
B.
B, Father.
B, Father.
RC. DRC.
B, Father.
B?
B.
Okay, let's check. Yes, B is correct. Proceed. Right. Step 3. That is the step 2. Okay. Question. You identify the hedging words, keywords in the question, and match with the text. Maybe 1 or 2 will be wrong. It's cool. When you go locate the answers, it will be cool. Okay. Step 3. Skim the 4 text and highlight the clues. Now you'll be skimming the text. However, if you want to skim the text earlier with the headings, when you find the headings there itself, you can do it. If you are competent enough, you can just skim together and highlight the keys as well. What have you highlight? What are you supposed to highlight? Yeah, skim
Name.
4 means highlight
Subheading.
Names.
Already we
Subheadings.
have done with the headings,
Name.
subheadings, and title. So other things, names or abbreviations of condition, medication, organ, test, symptom, device, all these names. Numbers or percentage,
Numbers.
symptoms, time or
Symptoms.
duration expressions, sequential expressions, frequency expressions, scale, adjectives, conjunctions, and last one,
Negative expression. Negative expression.
negative expressions.
Negative expression.
Yeah, even model verbs and all you can do, but then at this juncture you don't require. If it are some challenges, you can look into it later. This will be cool. Okay. Now, just tell me. Oh, one sec. Okay. Now, you'll have to identify these things here. Headings, subheadings, we have already seen. So, we need not worry about them.
Long term, Father. 3 months.
Long time.
Long
Where
term,
is it?
3
Yeah,
months.
long term.
More than
Long
3
term.
months.
3 months.
Yeah.
More.
Okay.
2 days or more.
Headache.
2 days or more.
Headache.
Where is
Headache.
it?
Headache.
2 days or more.
Headache is symptom, right? Yes. Then
MOH.
MOH.
MOH medicine.
yeah, if it is
Medication.
within brackets, it's not very important. Okay. You can
Okay.
have a glance at it, but may not be that important. Whatever is within the brackets, that is secondary.
Alcohol dependency, Father.
Where is it?
The second paragraph.
Other contraindications. That will be important, right?
C virus.
Yeah.
Renal or severe
Yeah.
hepatic impairment.
See, all these will be important, and one of the answers will be somewhere there. Shock and
Hepatitis
acute
C,
inflammation
Father.
or liver or due to
Hepatitis C virus.
hepatitis B. See, due to cause and effect language is always important. Okay, that signals due to
Non-cirrhotic alcohol
Shock
liver
and
disease.
yeah.
Cirrhotic
Next,
liver disease.
non-cirrhotic alcoholic
Alcoholic
liver
liver
disease. Okay.
disease.
Yes, under interactions.
Anticoagulants.
anticoagulants,
You have
Domperidone.
names of medicines, right?
Yes,
Yes,
Father.
sir.
metoclopramide,
Metoclopramide.
gabapentin,
Yeah, yes, you can underline and go as you glance through. It requires a couple of
There are
seconds.
numbers.
Numbers
169
total of
drugs.
169 drugs.
118.
Yeah, all these numbers can be highlighted. One of them could be the answer. Yeah, 62,
14 major drugs.
3,
14 major drug interactions.
118, 14. And here you have some expressions like what you call
Increase.
scale expressions, increase. Just having a glance at it will help you if there is something connected to that. Because increase and reduce are there, opposites are there. So when you find something in the question, you can reduce, increase, reduce. Okay. One second. Is the screen seen?
Yes, Father.
Yes, Father.
Okay. Okay. Right. So that is what we highlight the clues. Okay. Skimming for clues. These are the things. Normally you have answer from these things. Let's see next. So we have to identify this. We have a title here, section heading, subheadings. Then you have name, abbreviation, condition, you know, test names, hepatitis C virus, non-cirrhotic alcoholic liver disease, all names of conditions. Then you have names of medicines. Then you have number. Okay. These are things.
Screen
Yes.
blank.
Screen
That
is
is not
black.
visible.
Father.
Black
Screen.
color.
See, that's because somebody was writing on the screen. Now I'll have to stop sharing and share again. If it continues, we'll do that. I'll just stop sharing and again come back to it. Okay. Yes. So can you see the screen?
No, Father.
No, Father.
No, Father.
Again, no,
Yes,
Father.
Father. No. It's gone again.
Yeah.
Yeah,
Now
it is
can see,
visible.
Father.
Now, okay, Father.
Okay, Father.
Okay. Let me know if it goes black. Okay. This we have seen. Now you see time expression log term 3 months. You can see, right?
Yes.
Yes,
Yes,
Father.
Father.
I
Yeah.
can see.
Time expression, that is long term. Then you have abbreviation MOH.
Father.
And you have scale if you want. Then you have symptom, headache. Okay, name of your disease, hepatitis C virus, and non-cirrhotic alcoholic liver disease. Then you have names of medicines here, 3, 4 of them. Then you have scale expressions. You have numbers. Okay, this we have already seen. Yeah. Now, procedure for acute single overdose. What do I have to highlight here? I'll not be able to highlight because this is a table. What do you think is important here?
Hours,
Numbers.
Father. Hours.
Acute
Yeah.
single dose.
Yeah, hours, acute single
4
dose.
hours.
Less than 4 hours.
See, these are the most important things. Acute single overdose, establish time since ingestion. Time, dose, then hours. Okay. Somebody was asking me how to identify find out the answers so in the table. So these are the headings or subheadings of the table. Single dose, time, then hours.
Time.
Okay. Then at the end, after 4 hours, below 4 hours, 4 to 8 hours, 8 to 24 hours, 24 hours, or unable to establish, means not able to establish what time has passed after overdose. So they might ask 8 to 24, they might ask 10 hours. Then, you know, it should be here, right? Then below this, including all these, again, you have given some important headings like patient need treatment with acetylcysteine.
Acetylcysteine.
Okay. I love to learn that pronunciation. Okay. Okay. That is, so here you see no and S.
No S.
No means no need of this medication. S means yes, need medication. So the questions will be based on these no, yes, and hours, single dose, and the time of ingestion. Okay. See the time expression. Okay. Then you have hours. Then you have name of the medication. All those things. Okay. Now paracetamol overdosing. No, paracetamol poisoning, emergency treatment of poisoning. What are important here? In the table here, below you have hours, right? And vertically you have milligram per liter plasma paracetamol concentration. So hours and milligram per liter is important measurements. Okay, what else you have?
Normal treatment line, then high risk treatment line.
Okay,
Line
normal,
for
high
the
risk,
graph.
yeah, that's important. Then here in the text,
Time hours.
Name further.
text,
Name hours within 0 to 12 hours.
okay, it's 0 to 12
Vomiting
hours.
symptom. Then medicine.
Cannot be used. That negative
methionine.
expression.
Methionine, Father.
One sec. Give me 1 sec. I'm highlighting it. Oh, sorry. This should not be highlighted. 10 to 12 hours, right? There is something.
Yes, sir.
What else? Vomiting, you said. Then
Cannot be used.
enzyme
Medicine.
inducing drugs, medicine, right?
Yes.
Yes, Father.
And whatever is inside the thing, you can just glance through, but may not be that important, okay? That's how you save time. That is a secondary information. If at all when you enzyme inducing drugs, then they are asking about that, you can come and look into this paragraph, what is inside the paragraph. Okay. And or is always important, okay? Conjunctions. Remember I told you wherever or and conjunctions, fanboys come,
Yes, sir.
they are important. Just check whether this is important when you find the answers, okay? Who are malnourished or after, or you have malnourished. Whatever comes before or after or will be important after conjunction and before conjunction. Then there is medicine, right? Name of a medicine.
Acetyl system.
Above the high risk treatment line. Okay, that is cool. So this is how it goes. See, numbers milligram in liters, numbers hours this side, this angle, horizontal is hours, this is milligram per liter. Whenever there is a question about milligram per liter or hours, everything will be here. Then you have names of the medicines here. Then you have number here. Then you have or here, which is not highlighted. Definitely you have to highlight all the conjunctions. Yes. Then you have scale expressions above the high risk. High risk is the scale expression. Yes, treatment line. Cool. That's right, right? Shall we go to the next? Clinical assessment. Tell me what are the things to be highlighted?
24 hours. First 24 hours. Vomiting, nausea, and
Hepatic
conjunction.
necrosis.
Hepatic necrosis.
The system is teaching me
After
patience.
24 hours.
Yeah. Nausea and vomiting, right?
Yes, Father.
Then this one is
Hepatic
right.
necrosis.
Jaundice.
Then
necrosis.
Right upper quadrant.
Right
Jaundice.
upper. Jaundice.
Then elevated transmissions and brain pain, jaundice, all those things are names, right?
Yeah.
If you want, you can highlight. Yeah. What is elevated? What is this? Is it a name? Probably. Yeah. And there are many names. One will be important.
Liver failure.
Encephalopathy, oliguria.
Day 3 number.
Day 3, where is it?
Right hand side
That is
bullet point. Renal failure usually occurs around day 3.
Encephalopathy, oliguria, hypoglycemia.
okay. These are names, right? Are they
Yes.
medications? No.
No,
No.
Father. Listening.
Okay.
It's condition.
Conditions. Okay. History.
Suicide risk.
Time of overdose.
Okay. Alcohol. Anything else?
Enzymes.
Liver enzymes.
Okay, that's within the bracket. Still, we will just keep it highlighted here together. Secondary. Yeah. So that is which step? Done with which step?
3, Father.
Step 3, right?
Okay.
This one.
Yes. So you have, oh sorry. So symptom is there, name of the disease, abbreviations, all those things. Good. Clinical assessment. Sorry. To go back. Yes. Next step. What is next step?
Locate the answer.
Locate the answers in the
Locate the
answers in
question number 1 to 20. Now, first one, the various symptoms of patients who have taken too much paracetamol. You said it is in D, right?
Yeah.
Where is it? The various symptoms of patients who have taken too much paracetamol. Commonly, patients who have taken a paracetamol overdose are symptomatic for the first 24 hours or just have nausea vomiting. So the text is here, right? That's just to match the text. So information is in this text. Question number 2. The precise levels of paracetamol in the blood which require urgent intervention. You said is C, treatment, right?
Yes, Father.
Yeah, test C. The precise levels of paracetamol in the blood which require urgent intervention. Where do you have it?
Emergency.
Emergency
Emergency
treatment.
Emergency
Okay.
treatment.
Emergency treatment. Yeah, heading itself tells you. And question number 3, the steps to be taken when treating a paracetamol overdose patient. When you said steps, it is in procedure, you said text B. So to be taken when treating a paracetamol overdose patient, these are the steps, right? What is to be done, when, in which hour, all those things. So in general, they are speaking about procedure or the steps. 4th one, whether paracetamol overdose was intentional. You said D, assessment.
Yeah.
Intentional.
Suicidal. Suicidal risk.
Yeah, suicide risk was a note left. Okay. This is from the history. This is just to match the text. Then 5th one, the number of products containing paracetamol. You said it is in the text A, contraindications. Yeah, a total of 118 brand names are known to have paracetamol in their formulation. The number of products containing paracetamol. We have already highlighted that 118 number, right? And we said one of them will be the answers. Yeah, question 6, what to do if there are no details available about the time of the overdose? You said it is in procedure, right? Text B. 24 hours or unable to establish the time. There are no details available about the time of the overdose, which means unable to establish. You know, there is a conjunction here, right? Or 24 hours or unable to establish. So whatever comes before or after or could be the answer. Then 7th one, dealing with paracetamol overdose patients who have not received adequate nutrition. You said C. Where is it?
Or malnourished.
Yeah,
Malnutrition.
or we have a conjunction there who are malnourished. Yes, it is here, just to match the headings. Now next, 8, if paracetamol is used as a long-term painkiller, what symptom may get worse? A, you said contraindications. If paracetamol is used as a long-term painkiller, what symptom may get worse?
Headache.
Headache.
Yeah, analgesics are used long-term. Long-term is here, long-term is here. Okay, analgesics, painkiller, right? With administration every 2 days or more frequently, or there is again a conjunction. After that, there is an answer, right? Headache. Headache is the answer. See how the paraphrasing is used here. If paracetamol is used as a long-term painkiller, what symptoms may get worse? Okay, you know, analgesics, painkiller, long-term, symptom. What is the word used here? Headache. And may get worse. May develop or increase. See, painkiller, analgesics may get worse, may develop or increase. So those are the synonyms and synonymous expressions, and this is known as paraphrasing. Ninth one, it may be dangerous to administer paracetamol to a patient with which viral condition? You said A again. Which oral condition? May be dangerous to administer paracetamol to a patient with which viral condition? Other contraindications,
Hepatitis
dangerous, warning,
Hepatitis C.
shock and acute inflammation of liver due to hepatitis C. I said due to, when there is a cause and effect language used, usually there is a chance of a answer. Yes. Next one, what condition may develop in an overdose patient who presents with jaundice? You said it is in D. What condition may develop in an overdose patient who presents with jaundice? Yeah. Hepatitis, necrosis, elevated, all those begins
Acute
to
liver
develop and can progress to acute liver failure, right? What condition may develop in an overdose patient who presents
Renal
with
failure.
jaundice, acute liver
begins
failure?
to develop.
liver failure.
Renal failure.
Acute
What
liver
condition may develop?
Acute liver failure.
Acute liver
Right?
failure.
The question, listen to the question. Don't see the highlights, okay? What condition may develop in an overdose patient who presents with jaundice?
Hepatic
Hepatitis.
Hepatic necrosis, but
Again,
to
cause and effect languages. It's acute liver failure, right? Progress to is the language used. Cause and effect language
Begins
used.
to develop, may develop.
Yeah, may develop, can progress. Clear?
Yes.
Yes. 11th one, what condition? Again, they are asking a condition. You have to find a condition, name of a condition. What condition? 10th also was a condition, right? What condition may
Yes,
develop
ma'am.
on the third day after an overdose?
Third day.
Third
What
day.
condition
Third
may develop on
day.
the third day after an overdose?
Renal failure.
Usually occurs around day 3. Day 3, third day.
Renal.
Renal
Okay.
failure.
Renal failure.
Renal failure usually occurs around day 3. Yes. May also develop, may develop. Patients may develop renal failure. Usually occurs around day 3 on the third day. 12th one, what drug? So they are asking for a name of a drug, right? Earlier it was 10th and 11th was name of a condition. Now it is what drug can be administered orally within 10 to 12 hours as an alternative to this medicine. You'll have to read it. Okay. 10 to 12 hours. We have seen, we have highlighted. Some name also we have highlighted. So what drug can be administered orally within 10 to 12 hours as an alternative to this medicine? See, with methionine by mouth. Interval has taken within 10 to 12 hours, 10 to 12 hours. So when there is a number, there is an answer. Clear?
Yes.
13th one, what treatment? They are asking for a name of your treatment. Can be used if a single overdose has occurred less than an hour ago. Less than an hour ago. Less than 1 hour means less than within below this, right? 4 hours.
Yes, ma'am.
Less than 1 hour. You see that number, that the duration since ingestion. Okay.
Less than 4 hours.
What's the answer?
And consider activated.
Activated charcoal.
Activated charcoal.
Yeah, activated. Consider activated charcoal. Consider the treatment activated charcoal. See, less than an hour ago. Activated charcoal. Yeah, 14th one. If a patient has taken metoclopramide alongside paracetamol, alongside, we said interactions. This may affect the dash of the paracetamol interaction. If a patient has taken alongside paracetamol, this may affect the speed of absorption of the paracetamol.
Absorption.
Speed of absorption of the paracetamol.
Paracetamol.
Yes. Sorry. Fourteenth one done, right? Next one is 15th. After 24 hours, an overdose patient may present with pain in the dash. Where do we have the pain? Allocation. Okay,
D.
24 hours. After 24 hours, an overdose patient may present with pain in the
Right upper
right
quadrant.
upper
Right
quadrant.
Upper
Pain.
quadrant.
Yes, after 24 hours is the indication. After 24 hours. How easily you can come and just locate that 24 hours. Then 16th one. For the first 24 hours after overdosing, patients may only have such symptoms as dash. They're asking for a symptom. Name of a symptom.
Quadrant pain, right upper quadrant.
Normally, patients who have taken a paracetamol overdose are asymptomatic for the first 24 hours or just have nausea and vomiting. So the answer is nausea and vomiting. We have already highlighted. Yeah, symptom we had already highlighted. 17th one. This medicine should be administered to patients with a paracetamol level above the high-risk treatment line who are taking any type of dash medication. Again, one medication, type of medication.
Patient.
Type of enzyme-inducing medication. Patients on inducing drugs. Medication synonymous drugs.
Drug.
Okay. Should be administered to patients with paracetamol level above the high-risk treatment line who are taking any type of enzyme-inducing medication. Right? Is that clear?
Yes.
Yes.
Yes, Father.
And 18th one, a non-high-risk patient should be treated for paracetamol poisoning if their paracetamol level is above dash mg per liter 8 hours after overdosing. 8 hours is important. Mg per liter, one number they are asking for, right? And somebody was asking how to identify these things. See, the numbers are here below, right? Hours. Hours are here. How many hours they are asking?
Yes, Father.
8 hours.
8
8
hours.
hours is here. And then they are asking,
Dash
MG
mg.
yeah,
above dash
8
MG.
hours where it
Mg per
treatment.
liter.
This joins here, right? And it should be 100. 8 hours when you take down, when this line, no? Treatment line collides here, right? This line, normal treatment line. So that is the point.
Non-high
So
risk.
it comes with 100. If you go high, it will go below this side. So that is it, how you find easily. So the answer is 100.
100.
Yes. Sorry. 19th one, again, high-risk patient who overdosed dash hours ago. They're asking for an hour number. Okay, duration. Should be given exemestane if their paracetamol level is 25 mg liter or higher. So you have to look for a 25 milligram per liter or higher. Okay, high-risk patient.
High risk.
And you have to see the hours. You have to find out the hours. Earlier it was mg per liter you have to find out. Now the other thing you have to find out. Which hours you have to find out. Okay.
12 hours.
12 hours, right?
Yes.
Yeah. You want to see that again question? I did not bring it here. A high-risk patient who overdosed dash hours ago means how many hours ago should be given as limit if their paracetamol level is 25 mg per liter or higher. So you have to look at 25 mg per liter on the vertical line of high-risk patient. So which is the vertical line? This one. You have to identify 25. Where is 25? It should be between 20 and 30, right?
30 and
Yeah.
20 and 30. Okay. So this is 25. Now you have to see where this line collides.
High risk line.
25 or higher. Okay. You have to find out the hours. How many hours now here?
12 hours.
12 hours.
Yeah.
12
12
hours.
hours. So answer is
12.
12 hours. Earlier they are asking mg per liter, 100 was the answer. Here they are asking for the hour. When hour is asked, mg per liter is given. When the mg per liter is asked, hour is given. Just you have to take this way. That's all. They said 25 or higher. Even if little goes high or low, no problem because they are asking higher, right?
Yes.
Yeah, but then you cannot go to 40 in here. That will not connect with this line, right? Or you cannot come to 10. It won't connect here. 25 will not connect with the 10. See, if you take 10, 10 goes this way.
40.
The line will not collide, no? This line?
No,
This
Father.
line has to collide, yeah. Did you understand that?
Yes.
Yes.
Yes, Father.
There are
Like
repeated
graph.
questions on this, how to find out this. One of these will be given, other one you have to find out. Just draw the line, that's all. Usually they will give you 20 instead of 25, 30 or 40 exactly. So you clearly you know where it is. But now they have given 25 or higher, which means here. Clear?
Yeah.
Yes, 20 or if a patient does not require further,
Ethical
they should
system.
be given treatment categorized as dash only. Procedure you said. If a patient does not require further resource.
Supportive treatment.
Pardon?
Supportive treatment.
Yeah.
It
If
is
a patient does not require further this medicine, patient needs treatment with the doesn't require. So supportive treatment. No, I said no, yes or no. Based on that, there will be one answer. So supportive treatment only. See this indication. Name of the medicine. Yes or no. Okay. Supportive treatment only. Is that clear?
Yes,
Father,
Father.
could
Yes.
you, Father,
Pardon? Yeah.
can you explain again 18 and 19?
18th one.
Yes.
Let me go back. 18th. Where am I? 18th one. The 18th is here. Okay. Maybe let me one sec. 18th. Let me bring in that question somewhere here so that I can explain easily. I could not finish making the PPT when the time came up for the session, so I did not bring it here. 18th. 18th, right?
Yes.
Yes, yes, Father.
Yeah. Let me paste somewhere here the question. Yeah. Yes, this is the question. A non-high-risk patient should be treated for paracetamol poisoning if their paracetamol level is above dash mg liter 8 hours after. See, hours are here, right? 0, 2
Yes,
hours, 4 hours, 6 hours, 8 hours. Okay?
yes, Father. Yes,
8
Father.
hours. 8 hours
Mm.
after. And a non-high-risk patient, you see, normal treatment. This is high-risk patient, this line starting here
Yes,
below. This is non-high risk, normal patients. So 8
yes,
hours you have
Father.
to go above till that line, not treatment line collides. Where does it collide? Here, 100, right?
100.
100.
They have given the hours in your question. So you have to take a line straight up and see where it connects to this line, this treatment line. So it connects with 100, right?
Yes, Father.
Exactly that one. Next one, they will give you the 25. They have given this one. mg per liter in the question. Now you have to draw a line from here to see which hour collides. See, high risk they asked, and it is 12, collides with 12.
Okay, okay, I understand now.
Got it?
Yes, yes, Father.
Once you understand,
Thank
it's
you.
very easy. Just draw a line, finished.
Yes.
Normally they ask either this one and that one.
Now I understand, Father.
Okay. Anything
Thank
else?
you so much.
Father,
Mm.
13th question. Can you
13th,
yeah, a bit confusing.
13th, 13th, 17th. Yeah, 13. This one, right?
Yeah. This one.
What treatment can be used if a single overdose has occurred less than an hour ago? Less than an hour ago. Less than an hour? Less than an hour. Less than 1 hour. You can see here, right? That's why I said the duration and numbers are very important. Since the question speaks about less than, what treatment can be used if a single overdose has occurred less than an hour ago? When there is a number or duration, immediately search for the number or duration. And you know, less than 4 hours, less than 1 hour must be under less than 4 hours, right?
Yes.
Yes.
Yeah, so that is one clue. Immediately come here, 1 hour since ingestion. Less than an hour ago. What treatment can be used? They're asking what treatment. Okay, just and per kg taken. Consider activated charcoal. Consider means that is a treatment, right?
Yes.
What treatment can be used? In other words, what treatment can be considered if a single overdose has occurred less than an hour ago? Use this synonym of consider. Is that clear?
Yes, Father. Yes.
Less than an hour ago is here. Less than 1 hour. Okay. What treatment can be used? What treatment can be considered? Consider activated charcoal.
Yeah, but like, you know, if you focus the treatment, we can go to the I mean, you know, the C text. Treatment is, you know, the treatment is meant to be, you know, the C text.
Okay.
So that's I'm just confusing.
Okay. What treatment can be used if a single overdose has occurred less than an hour ago? Okay, that could be a confusion sometimes that way. But then, you know, here I said you have to look for, when you skim, you have to look for hours. You have hours,
Single
both the places, but one place that is only connected with mg per liter. In text C, the hours are connected only with milligram per liter paracetamol concentration. Okay, the vertical line and horizontal line you have to see.
Yeah,
And
Father.
less than 4 hours. Those hours will guide you.
Okay.
At least 1 or 2 should be little challenging, right? Otherwise, you will be scoring 500 out of 500. Examiners will be a bit sad if everybody scores that way. And all will say, oh, it is very easy.
Single overdose also clue.
Single overdose also we can consider.
Where do you have the clue?
In the
Single
question and
overdose.
paragraph.
The headings single overdose.
Heading is
Single overdose, yeah. That's why I said the headings are always important. For which I said beginners will write procedure for acute single overdose, then they will circle procedure. So when they say single overdose in the question, you can come here. You can write the whole heading also. Okay, that's why I said first you have to understand the heading, title, heading, subheadings, visualize them. What could be, you might have seen, I have explained visualization in the first method, how to visualize, that will help you. Anything else?
For the last one, for the 20th.
20th. Yes. 20th. If a patient does not require further, I will have to learn that. Still, tell me how is it pronounced?
Acetylcysteine.
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 Yeah.
Acetylcysteine. Okay, acetylcysteine. They should be given treatment categorized as dash only. Which category of treatment must be given when patient does not require this particular treatment? One sec. Let me go to the. Yeah. Patients needs treatment with acetylcysteine. So no or yes, I said these are important. When you need, when you don't need. When you
Need or not.
need and no need. See, patient need treatment. No need. Yes, need. The question is asking if a patient does not require, which means don't need. There are no need. No? Need, does not
Yes.
require. They should be treated with what?
Supportive treatment.
Supportive
Supported
treatment.
treatment.
And
Only also is there.
only
Father.
is also a clue, yeah. That's why I said always consider the words before and after the gap. That will also help you. Is that clear?
Yeah,
Yes,
Father.
sir.
Thank
Yes.
you.
Yes, Father.
Yeah. Anything else? Maybe this is the most challenging among the 5 samples given. Others are very easy, but then this gradually as you practice, this will be cool. Diagram, if you don't understand, let me know, okay? That is simple. Once you get the clue, diagrams are simple. But another thing I tell you, these days you may not have diagrams given in your exams. And the students report there was no diagram, only 4 texts. Consistently, they are reporting that way when they write the exams when I ask them. Yes. Any other questions at the YouTube comment space? I didn't see the comments. Concerns in listening part B and C, please. How do I navigate the correct answers in these parts? Yeah, we'll be coming to that one of these sessions. Yeah. Provided if there are interested people, yeah, definitely. Listening, we will be getting into listening, writing, reading, speaking, all the 4 modules we will be looking into. If there are sufficient people, we have to share and connect people. Otherwise, if there are insufficient people, we may not be able to go on with the sessions. That's the problem. Otherwise, we'll get those people only in the Zoom without live connected. Anything else? Admins, could you just please check the comments, YouTube comments, please? How do you get the answer of question 18? Please, more explanation. I did explain, right?
Yes, Father.
Do you require again explanation? Or the
No,
question
Father.
was asked before, I believe. Yes. Then wonderful explanation. Thank you. Any other questions? Can I stop sharing the screen? Hello. Did I get disconnected? No.
Yes, Father.
Yes, Father.
I was wondering, there was no response. And any other question? In fact, I made a lot of slides. It time consuming it was, but then I wanted to give you that clear idea of the steps. You can even interchange the steps, okay? If you're competent, you can just go in the initial go. When you identify the text headings, you can immediately look for the clues in the whole text within 20 seconds. You get the headings at the same time, 20 or 25 seconds per text. Maybe in the initial beginners will require more time, don't worry. Identify the things and find out which is that one. Write down those clues, 10 clues on your pages where you practice, or keep on a notebook page fixed on a wall or somewhere. So when you find them, circle and write name, medication, name, device, name or symptom or number. All those, keep writing. That helps your competency. Anything else?
Yes.
And listening, you will be definitely looking into how do you get a speaking partner. Yeah, for speaking partner, we will be giving, once we know that you are a serious learner, we will be allotting one admin is in charge of it. She will allot you. Okay, you can ask for. Yeah, you can message me, no problem. Provided you are a active learner. Because some people come only to get a speaking partner and then may not have known anything about EduSkills method of learning teaching or doing teaching. Then they will be disturbing the other person who is really active. Okay. They are an active learner here. You'll be given not a speaking partner. We give you a learning partner. For all the 4 modules, subtests, you will be interacting together, discussing together. Yes. Let me remove the focus mode. Shanmuga is here, right?
Yes, Father.
Shanmuga, I wanted to ask you about There are so many people asking about the discussion. Now the present discussion group has already advanced almost
Yes,
60%.
almost. Yeah, we are in listening
Yeah,
all day.
so will you be able to assist with one group somewhere where you can post the tasks every day? Separate group that will be, because the
Yes,
other group has already gone to 60%. Now they don't want to be disturbed in between. And
exactly for that.
those
I
who join,
accept that one.
yeah, those who join also may not benefit much because if they are beginners and all, no?
Yeah,
How about
we can do
starting
that.
one?
Yeah, I saw a few messages last week as well.
Yeah, not few messages. I get so many messages. How
But
can
initially,
I? How can I join? How can I join? And the other group was doing wonderful, yeah. So I don't want to disturb them. 8:30 is the time, and maybe this time we will keep Shanmuga a comfortable time for UK learners instead of 8:30.
okay,
Since I have holidays after 16th, I can open up, no problem. I can adjust my sleep timings, no issues, if it
but
helps.
it's going to be.
Pardon?
But
What will be
we
the?
can help them out further. Yeah,
Yeah, maybe a
we
later
can.
time, like 10 or 10:30 will be convenient for UK people, right?
Hopefully, yes, it is. After
What time you
9,
come after
we are
duty
now.
if you have a day duty?
Always I have day duties. So far, I
So,
didn't start my nights, but I come
what time you
around
reach back?
9 o'clock. 9 o'clock.
Indian time?
No, in UK time. 9 o'clock means in Indian time, it's going to be like around 2 a.m.
2 a.m.
2 a.m.
Oh, that
Yeah.
will be too late, right?
That will be too
Yeah.
late because my duty finishes at 8 o'clock.
8 o'clock
Mm.
UK time.
Yeah, UK time, 8 o'clock.
No, if somebody can open, I can give the credentials of the platform. If it is too late, if it is somewhere around 10:30,
Because
11, I can open.
yes, mother, because if the UK learner wants to have a class like by UK timing, at least they should start by like 7 or 7:30. That would be better for everybody because 7:30 Indian time will be like 12. Yeah.
Okay. Now we can have one like
But I have
7:30.
only 3 days. It's very rare that I get 4 days in a week, but I have only 3 days. But if
Yeah,
it is continuous 3 days, then it's going to be difficult. If it is there here and there, then I can manage.
no, I can assist you. Don't worry, and we can find out somebody who is an active learner at that time. No?
Yeah,
Maybe
yeah.
discussion
There
could
is
be
somebody to.
somewhere around 10 or 10:30 will be cool. Discussions.
Yes, for that. If the people are okay, if there is somebody to open Zoom, then that would
Yeah,
be
10,
great.
10:30 I can adjust my schedules since I have holidays after A16.
But still, further, it is too early for Indian timings.
Uh-huh. Now, Indians
Yeah.
it will be late, but UK it will be too early, right?
Yeah, UK till 5 o'clock, 5 to 6. I think it will be okay because
Okay.
even people they can join around 5, yeah, 5 or 6 because during that time they will have some breaks as well if they are doing even 12 hours duty. If they want to join like for half an hour or 10, 15 minutes, then it's going to be worth it. But
Yeah.
there should be
No,
somebody
it's
to.
going to be very useful because the present batch, earlier that CG Thomas and all those who came people, those who interacted recently in a live session, they were like 9 or 10 people in such a discussion group. All of them passed together. They went together. They are almost together now around in the surroundings, and they had a 2-day gathering, Edu Skills aspirants gathering after 4 years in UK.
That's
Yeah.
great for us.
So, and the present team is going good. I think who are all here? Valli is there, I think. Beulah.
Yeah, Valli is there,
Okay.
Beulah is there,
Yeah. Could you
Jaya is
just
there.
share how does it go for our
It's
others'
going further
information?
now. Today, part C listening.
Okay.
Almost we are going to the part C listening this week. Part C listening is going further. Going to
Okay.
finish. By
Yeah.
next week, maybe plan another.
Yeah.
Father. It's
Yeah.
very, very
For
useful,
Dorothy
Father.
is very eager with the discussions. Always, if it is online, if it is offline, doesn't matter for her actually. She joins everywhere.
Who?
Dorothy.
Dorothy. Okay.
Yeah.
Yes.
There are people for the discussion, but
Yeah.
yeah,
Not
only
only for this one, OET, I tell you from the experience, you need English for life. When after
exactly.
going to UK, the better you can communicate, easier you will enjoy the whole process. And Anita
Even
Taj
though
also is
there are
doing.
people still struggles with the English if they are coming to the UK with the
Yeah.
accent. Yes.
And I tell you see, recently my sister delivered a second baby, and they are small kids. She was teaching in Bangalore, Christ School. Now teaching was challenging for her with the kids. So now she is teaching online evenings, UK students. If she teaches one student teaching English, they get 500 rupees 1 hour. Two students, 800 rupees. Three students, 1,300 students. And she teaches 1 hour or hardly 2 hours, and she almost gets 50,000 plus. Just 1 hour or sometimes 2 hours. Okay. That the agency is giving her. If she is given 500, definitely the agency is getting 1,000 rupees.
Yeah.
That is the cost people are spending on learning English. Not only English, maths, any other subjects, all the subjects. But then here we are giving it free. That's why people don't consider it valuable.
I can give task and everything. If there is no duty, I can take care of even discussion for that. But
Yeah, no.
if
Mainly what I want you to is you can post the task, right? In your own
yes,
convenient
sir.
timing, you can take. We'll
Yes,
fix one
for the
time.
right, I can post it even if it is like we can have a fixed timing for like
Yeah, you
5
fix a
o'clock. I
time.
will
Any time
give the
is okay.
task.
Whatever is your convenient time, fix a
Yeah.
time and post it. And whenever you are not able to join the discussion, I'll be there. Okay.
Yeah, opening and
Oh.
also I cannot record it. So far I don't have laptop. I
Which
will
one?
try to get one. For the Zoom.
No, I can give you my credentials. You can record and do everything. My password. No? That's how the other group, Mini, is doing it. Mini Jackson.
I don't have laptop for the.
Oh, sorry, you don't have laptop.
Yeah.
Anyone else who want to volunteer to just those who want to join the new batch of discussion, starting from the reading party A. It goes like this. First 1 week, 6 days, reading party A discussions. Task will be given, discussions will go on. Second week, reading part B, task will be given, there will be discussions. And third week, again 6 days, part C, 2 texts. Then on the fourth week, we'll have 6 days mock test. Okay. In between every week, if there are some concerns like this, you want one party A to be discussed or taken session, I'll be doing it. So then you'll have 5 days discussions, 1 day live session by me. Then again the same routine for listening. Listening A, 6 days. Listening B, 6 days. Listening C, 6 days. Then 6 mock tests. Then reading and speaking. No, writing and speaking, exactly the same way, 4 months. And once people are ready and active, we'll create a separate group for them. Then you can interact there. You have the tasks earlier you gave, right? Shanmuga, you have a
Yes, Father, I have
things
tasks
ready
and
there.
also you shared some materials that we
Yeah.
haven't
Good.
used for.
Can you just fix a time? What time? Indian time you can post. Take your own convenient time. Any time is okay. If you know it is a
Anytime,
time.
I'm also fine with any time further. If the aspirants are okay, and I can even share like Indian time by 8:30, means 3 o'clock, our timings around 3 o'clock. Yeah.
Afternoon.
Yeah,
But it will be duty time, right?
but I will have like at least 5 minutes I can take. I can
Yeah.
have this task.
Okay. Any time is okay, provided people know this is the time when the task is shared.
Yeah.
They will look at that time or after that
Yeah.
time. Yeah. You just let us know when it
Just
is.
have
Any
5
time.
minutes for that posting a task. If I prepared for it, yeah, I usually I will prepare for 3-4 days earlier for a alternate task. Otherwise, it's going to be
Yeah.
yeah.
Anyone else with a laptop want to assist Shanmuga? Now, most of the time I can be there, no problem. But then sometimes for some reason. So time, how will you fix? 10:30 is okay or 10 o'clock?
We'll ask the students further.
Okay.
We'll ask aspirants
Okay.
which will be the best
Okay.
timing. Probably
So you
they
just
will say like
you,
8 or
Shanmuga,
7.
you can post a small notice
Yeah.
so that I need not answer everybody. Tell them Father will not be answering everybody, so you can respond here. Okay. Yes.
Everybody should visit at least main group once in a day.
Yeah.
We know there will be so many messages, so many notices, but
Yes.
still they
So
can
when people are when the aspirants are active, we feel like today's session was asked by Sash Anthony. He's a very active participant, and
yes,
even in the
Father.
main
He was,
platform, spam alert, everything. So when we see them, their request immediately we yield whatever we can do for them. Actually, now people ask one-to-one session. What is wrong? Now Sashan was listening to my session. At the same time, Shanmuga was listening from UK, another one from Sudan, another from Pakistan. Sashan understands, right?
Yes,
And you
Father.
have enough.
Thank you. Thank you
Yeah,
for
you
this.
have. Yeah, and you have enough time to ask me clarification. So then why do people just stick on to one-to-one session? You never had one-to-one session during your BSc nursing or medical studies, right?
Yes.
So then how did you get this concept? I don't know. Everybody asks for
they are
one-to-one session.
thinking one-to-one means they will get more attention, more focused with only one person.
Now
But
you see,
it's
whatever you ask, I remain for so long. You can ask now. Yeah.
Yes, Father. And also they can I mean other participants also benefited from the same question. Maybe she's showing how.
Not only that, the person also will benefit from others' questions.
Yeah.
When someone else asks questions, yeah.
I can see so many messages in YouTube comment space. They want to join new batch. Four messages
Where is it?
so far. In YouTube comment space for that.
YouTube comment space.
Yeah.
Like to join the new batch. Okay. All you can, if you maybe you cannot disturb Shanmuga, everybody messaging her. Probably you can message in the main platform. We will ask somebody to collect and give to Shanmuga.
I can add for them. For past 3 days I'm at home, so I don't have any other
Okay. Or if you can put a message in Telegram to Shanmuga, just her name is Shanmuga in Telegram. You can just search for Shanmuga and put a message, all the beginners, and I will be guiding you. This batch will have more time because I have my vacations at this time. Yeah.
Father, Anita here, Father.
Yes, Anita, tell me.
Father,
Hopefully
I
the
have
Middle East people are good, taking care of
going good.
Anita is going great. Yeah. Actually, I wanted. That's what she showed recently. She collected all the synonyms and synonymous expression from all the practice materials, day 1, day 2. Exactly, I was telling them since a decade, I am telling the people do that. Don't go for by hearting list of synonyms and all that. Whatever you find in each practice material, just write down, keep a diary. That is the best thing, and she has done it very well. Yes, Anita, you wanted to say something?
For that, what I practiced.
Pardon? I didn't get you.
Still, I have notes with what I have practiced.
Okay, great.
Yeah.
Shanmuga passed OET maybe 3 or 4 years early. Even now she comes and attends sessions.
Every day I'm having one takeaway.
Okay.
Yeah.
Anita Taji wanted to say something.
Yeah, Father, whenever when I joined EduSkill, I was hearing about the synonyms diary, right, Father? So I had my own diary or format from that time, but this one is very particular because when we started discussion, the special influence of our Minnie Jackson and Nitya, they were also influencers for this particular diary. But we recently made, after starting discussion only. Yeah. Now, further, I wanted to ask you something. Whether next discussions, whether you will be able to add some questions. The options will be asking for illustrate. It will ask for illustration. So some examples, two, I think I forwarded you 2 questions. I will send you again. And some more questions only about how to understand the difference between illustration, explain, address, and clarify, like this things.
Okay, sure. Illustration, usually that will be answer will be in the developing sentence. If you have followed my paragraph structure, whenever there is a word illustrate, the answer will be in the developing sentence.
Okay, Father.
Yeah.
But
We will explain. Yes.
That's all. This was not commonly seeing. That's why.
And I would like to have at least someone who want to do more practice. One of those who are in that other group to join us in the new discussion group, so that you can assist Shanmugha. At the same time, you will have practice. Those who need more practice, no? At least for reading and listening, because almost we are reaching the end of your discussion. Like listening, with listening, it will be over. Main thing. Then you have writing and speaking, definitely, but then all may not join there for those modules. So if somebody wants to join this group, let me know so that we can guide, help Shanmugha. At the same time, whatever you experience now, you can share with other group members, new members. You can guide them as well.
Yeah, Father, I will Nitya and Minnie will talk in the discussion group, saying what you asked, Father. Then we'll let you know. Okay, Father. Thank you. Yeah. Because some UK people are there in that discussion group.
Yeah. They can join. It will be good. Their timings and all those things can be arranged. No, it's going very powerful. I really wonder how beautifully they explain all the strategies. They get it and explain it wonderfully. They explain. I didn't get time. Otherwise, I wanted to upload. I will upload these days. I'll be uploading those sessions, discussions. They are beautifully done. And now they are able to take up new materials, which I have not explained, and explain perfectly well, which means they have really gained the competency.
That's what we want for this. At least one member, at least a few members, that should be.
Yeah. Now that group is going good. That's why I don't want to disturb them in between. So let's start one. That will go at 8:30. This can go at 10 o'clock or 10:30, whatever time it is. And this time we will be focusing more on going on step by step. You can give suggestions. And we will take up sessions when the A is going on. Definitely, I'll take up at least 1 or 2 sessions. At least 1. And 5 days you have practice. Then B also will take up. C, everything will take up sessions, new materials as well. One new material I will be taking up, one new material you will be taking up, which I have not taken up. So 4 previous ones and 2 new ones. So when you take up a new one, we know what is your competency without any video to support, listen to. And listening is much more interesting. Only thing, when you have to take sessions, you have to divide the audios, and it takes time, more time. PPTs are required at the same time. Audio support systems are required. Takes more time. That's all. It terribly took long time for me, this party paracetamol. But then I wanted to give you a clear picture, making PPTs. Because other things, just you can highlight and go each text. Here you have to bring the questions to the text, clues to the text, and everything to the text. Yeah. Any other clarifications? Anything in the YouTube comment space? If I have not noticed, you can either, if you want to join here at Zoom, I can just post the link there, or you can once again you can type it there so that it comes to my attention. Because when you take sessions, we won't be able to focus. See, I'm posting the Zoom link there. If anybody wants to come to the Zoom classroom and interact, ask some clarifications, you can ask. Okay. And whenever, if I have not answered any of your concerns in my sessions, you'll have to ask me again, okay? Sometimes we just forget, goes out of our. See, from Edu Skills, the link is posted at YouTube comment space if you want to join the Zoom classroom to ask something. In fact, 5 minutes, yes. Yeah, thrice I have posted the Zoom classroom link. Yeah, what else? How did it help the discussion? Somebody wants to say that? How was it
Yes,
helpful?
Father, very useful, Father. Thank you for the opportunity, Father. Every day we are gaining on one strategies, then we're learning the others' words. That is very useful, Father, in
Yeah.
our learning
But there should be
process.
somebody who is strict like Nitya, right?
Yes, that Nitya ma'am and Mini ma'am are very, very helpful,
Yeah.
Father.
Yeah,
Because
Father,
of
one.
them only we are forced to do. Otherwise, it's very difficult because someday we miss also. We are strictly we have to do like that. We are strictly committed to us. So that is very very helpful for us for
Yes.
the
Yes,
consistency.
Father. One more point I just want to add, especially when Malli said, because everyone in synonym collection, everyone has role. Okay, Father, everyone gather their own synonyms sent in the group, and we gather. It's a synonym bank. That
Yeah.
we say.
I saw one page earlier, and in the previous session, I did explain about it. That's what I wanted. Then now they have the full list. But now
Yes.
don't ask me now immediately as soon as I speak of some list of synonyms, people will be messaging me, send me the list, Father, send me the list, Father. That's not the idea. You have to create your own diary, then only your brain will take it. Just having long list will not help. In the context, synonyms and synonymous expression should be understood in the context. That's why you have to keep a book where you write synonyms, synonymous, then the paraphrasing alongside. So
Yeah.
it becomes very, very easy.
Yes, Father. So each word when we read, no, Father, one story come behind us.
Yeah,
That is
yeah.
the thing. That is like
Yes.
that is a benefit. Thank you, Father.
And one more thing, Father, when we want to present, we will go deep into it. Like we'll find out everything. Why
Yeah,
this sentence? Why we have to
teaching
apply
one
this?
teaching once is equivalent to learning 25 times. Clarity will be there. And Jyoti, whenever you have time, you can take some sessions, okay? I can
Yes,
open
Father.
the Zoom and whoever
Yeah.
wants to, will invite them. Anytime is okay. Anybody wants to take a session, you can. Because people will understand your language better than my language because you are medical professionals. You know how to tell them, how to make understand, give examples. Still, I remember there was one doctor lady who was taking sessions with all the hospital examples. What was her name? Noor, right? Noor, I
Neelu.
think. Neelu, yes. Neelu. She used to explain all from the hospital settings, this one, that one, this one, that one, what we do in the hospital, no? Which I can't do. I am not a health professional. I don't even get some names of the medicines. I have to go to the dictionary and find out the pronunciation is. And I find very sad sometimes. I was going through some groups like, very sad situations. They are getting some wrong resource from somewhere, some books or something they are purchasing. And recently I saw uh, maybe one full day discussion about the wrong thing and confirming it is the right thing. And the thing was said that spelling mistakes are okay in listening. And they said instead of something like some medicine, I remember, how bad it is in the sense people will believe that, right? Then they will do, yeah. One sec, I'll tell you. One more check.
Dad. Bless me, Father.
Bless you. God bless you, Ma.
Yeah.
Yes. See now. I don't find it. The thing was that one name of a medicine wrongly spelled, and they said in listening, no problem. You can, and any name of any medicines or conditions making a mistake, it is a great mistake that will be penalized. In listening, only minor mistakes are tolerated. In the sense, instead of better, BETTER, you miss one T, that's cool. It should not distort the meaning. It should not distort the pronunciation as well. But people give wrong teachings and go on like, oh my goodness. And it's not their mistake. They believe those resources are authentic and they take it. And regarding writing, lot of misgivings. That's why people lose the exams. They practice a lot, but they practice wrong things. They were giving examples saying these names can be pronounced or written differently. No, they are major mistakes, not minor mistakes. And it's not a safe way to make mistakes. Why should we make mistakes in writing answers? Especially in listening part A, if you make mistakes, you simply lose the marks, right? Yeah, anything else? Today, the whole thing was out of control, technical issues. Since my laptop is a bit elderly, it's teaching me patience as well. Almost an hour was spent on it, rectifying it. Yes. Anything else? Somebody joined recently, want to ask something?
Nobody joined further. I don't know.
Just now somebody joined, I admitted.
Okay.
It is. Yeah. Maybe those who are at YouTube, they will be busy with other things as well. Duty and all that. Yeah. And that is the best way. Okay, much more than my sessions. These discussions are the best way. And when I edit them, I really understand how competent they are. If I have to correct them something, if I have to give them an easier way or teach them a better strategy. So I do that. And one thing I wanted to know, as per this one, your university BSc nurses, once you pass BSc, you are allowed to teach BSc students, right?
Yes, further. Yes, further.
Does the university allow that? I don't know.
Yes, further. We are
Tutor,
allowed to
father.
teach.
That is a tutor.
Yeah, lecturer.
Tutor, like tutor.
Lecturer, father.
Actually, as per UGC and all, without a master's, nobody can teach, can be a teacher. Minimum is master's.
Actually, yeah, Father, BSc, I think after completing BSc, they teach for JNM student, actually. MSc,
No,
they
BSc
teach for
we can.
BSc. As
No,
my
further.
knowledge, actually, I don't know.
No,
No,
BSc also they will go as a clinical instructor, father. Like they will assist in the clinical.
Yeah, it is like that.
More likely they will go
Basic
for a
and
clinical.
clinical side.
Where
They
the
can.
major subjects further.
I will
Like the
ask my brother.
fundamental.
Yeah, I will ask my brother. He's a syndicate member of Rajiv Gandhi University.
Actually, master must be there for the BSc, and BSc can work as a clinical instructor for BSc
Now,
student.
what I was doubting, how did this idea come in? Because those who passed OET reading, they will start teaching OET reading. They might have by chance, by luck, passed OET reading, and they start teaching.
I think BSc students, they can teach further because they do have classes, they do have practice sessions to teach. Yeah, research, and also we have to do classes to get some marks.
Mm-hmm.
Then
Yeah.
last year we will do
We will
research and
prepare.
also clinical practice.
Yeah, normally in any
Especially.
field, for example, those who have done BA cannot teach BA students. Never can teach. Only MS. Those who have completed MA, that's the minimum. PhD is
Yeah,
required.
yes, yes.
But even
That
as
is
a
correct.
guest lecturer, PG is mandatory for all the subjects. But only in nursing, I
Yes.
found this exception. I don't know
Yes,
whether it is
Father.
open.
In fourth year, we have 4 or 5 sessions we need to teach the students with the as you're doing like a PPTs, and there are so many methods to teach as well. We need to use crafts, and we need to use some handouts, and also we need to use so many materials to teach and get score. We have been evaluated instead of that teaching methods while we are doing BScs.
Yeah.
Yeah. And also
So,
after BSc they have passed, then they are going for the same colleges. They are going like doing fundamental lecturer.
no, I think two things will have to be thought of. We will take a security amount. Then when they are really doing their business like our discussion group, we will return the money. Otherwise, they will lose the money. We'll give them for some charity. Then people will be a bit serious, I believe. Second thing, we need some people who are very strict. I can't be very strict. I don't know how to be strict.
Yes, Father. We should be more strict than this one, Father.
No, I never get angry with my students anywhere. Last 30 years, I never got angry with any students.
Usually the teachers are not getting angry, Father. I don't know how they have that patience. I don't know where it comes from, but usually teachers are really cool and
Yeah,
they're
because
handling.
that's why they are known as teachers, right? If they are getting irritated and angry, how can they teach? Students will make mistakes, and their mistakes are our syllabus.
Father, especially English teachers won't be angry, Father. Maths teachers only be angry, I think.
No, why getting angry? You can never teach students. Only with love you can imprint something in their brains. They may learn by fear, but that will not retain in their permanent memory. Only what is very positive and pleasant will be remembered always. Unpleasant things will be, mind wants to forget it. Yeah. I have challenged thousands, more than lakhs of students last 30 years. If you can make me angry, I'll give you 25,000 rupees.
No, Father, it's
The
not
live
possible.
classrooms.
I have come across so many teachers, but still, most of them they are not getting angry towards their students.
But nurses have
Whatever the mistake is, really they are really so patient towards the other people.
Health professionals want something like mother-in-law attitude to make them obey. Teacher must be like mother-in-law, then only they will obey.
No, Father, even health professionals, I don't know. We used to get some angry, but still, it should be like a firm, not like.
But nursing charges will be very serious, it seems, with other nurses.
Also,
No,
nursing
it
tutors,
should not
Father.
be helpful, Father. Actually, if they are, as you said, if they are getting angry, and if it is not, that is not good leadership. Actually, when it comes to the clinical.
Actually, Father, generations gap is very difficult to manage in nursing. The new generation is difficult to handle, actually.
The best solution is love has no difference in any generation. That's the only solution. You love, everything will be cool.
Yes, Father, that is correct.
Yeah. Love is same, whether this generation or next generation or other generation. A hug to a child, a kiss to a child by mother or father is same, any generation.
Really, this generation people, they know what they want, Father. Actually, they know what they need to get it, so they are really good at it.
Yes.
Actually,
Life is great.
Father, actually, we need to have the patience. That is the most important. We need to have the patience.
Yeah.
That is the most important, actually,
Yes.
according to my opinion.
Yeah. Patience and consistency can kill anything.
Yes.
It's a great killer. And I thought of spending a little more time if there are serious learners, a group of them. So we'll have to find out some methods to make them serious. When they don't pay, they are not serious. That's the problem. Not since decades I am facing the same issue with these free
That
programs.
is the main thing, Father. If they are getting paid, at least they will have some thing in their mind.
So
We paid and we
we'll
need to
think
learn.
something like that. Other than those really financially struggling, we'll get an amount as a security, caution security. I will
Yes,
enter
Father. At
somebody,
least it's like a
and if
deposit.
they,
When you pass, then you can take that money back.
if they prove they are doing everything well, that will be refunded exactly that amount. But if they go wild with the practice and they do
It's
whatever
up
they
to
want,
them. If they want to take
that will
it
be
back and they got it cleared, then they can leave it, or they can get it back as well.
Otherwise, people should be strict. Now, this discussion group is going because they are little strict, like admins are
Yes,
strong. They want to give.
initially, really, I really pity for Nitya because I just left abandoned her for a month. I don't have anything like support for her. I didn't give much support for her.
But she's managing well with
She's managing well, yes.
Mini Jackson. Yeah. Yes. That's great. If somebody wants to help, no, they can. Like we spend a lot of time. Like they need not be always there. No, once you begin, you can just listen to. Need not be always in the session. Like at the end, if they are there, that's cool. Some compliments, some comments, some corrections. That is fine. No, this was running like that earlier. Like no, that when our founder admin was there, Soumya, for almost like 4 years, she was alone, but she was doing great. She has brought the group from 4 members to 36,000. Yeah. Then the turn of other people. It reached 52,000. Yeah. Any other suggestions for the next class? Yeah, Valli?
I have to go for prayer, Father. For prayer,
Please,
special
please.
prayer today,
Yeah,
Father.
anytime.
Yeah,
Please. Now this is
thank you
only
so
for
much, Father.
discussion. Yeah.
Thank
Only
you
if
so
they
much.
want it. Yeah, you are most welcome. Yes.
Thank you, Father.
You can. I stayed back because if somebody want to, I can't answer all the messages in the WhatsApp. No, it's impossible. So answering here, even those who listen later in the YouTube, they will understand, get the answers. That's why.
Okay, thank you.
You can.
Because of
Sure.
the war, we are praying. Thank you, Father. Thank you so much.
Yeah, sure. Yeah, definitely.
Father,
Viola,
Edith has
how
completed
is
our.
your safety?
Yes, Father. Thank you
How
for
is
your
your?
prayers.
Yeah, we are praying. We are praying for all. Cool, man. Nothing will happen. Even my younger brothers are in Gulf. They are working there. No problem. God will take care. Don't worry.
Thank you so much.
Okay.
Here,
Yeah.
Saudi, they have attacked Aramco, Father, but it's far from our place. We are 100 kilometers away, so it's no problem for us here.
The first day I have seen the lightning.
No, those things usually they disrupt in the sky itself. Normally, 99%. All the countries are prepared for that. Very rarely something will come down because they will intercept in the sky itself, even if something is used. Normally, unless it is for the airport and other places, normal residential areas, normally they don't target. Unless it is in the extreme war problem positions. Let's pray. Somebody else was asking something.
Yeah,
And all
Father,
those,
about
all
ebook.
those who have sent me materials, just remind me again, okay? If you have not, and you can send in me again and tell me already I have sent, or you can put it in reply mode and tell me the material I have sent for the ebook, no, which I asked some have sent me, video link and material. So whenever you watch, like I had given the list, maybe somebody can share it later. Whatever is included in the ebook, around 9 topics, 9 materials. Other materials we are adding. So with one more material, I think the 10th material will be over. We are working on 15 materials, so that 10 for 5 practice, 5 mock test, then 5 additional if at all they want to have their own personal practice with all the explanations. The second volume will be coming out with another 380 pages soon. Yeah. Yes. With that will be the final solution. For all modules, we will have ebook with all the explanation, all the links systematically arranged. They can first practice, then look into the keys, find out their mistakes, then listen to the video, understand, then if they want, again read the PDF explanation of the video and understand. Yes. Need not go anywhere. In one place, everything will be there. One book. Yes. Now many are the old students who are abroad now. They are telling me, Father, you never gave us ebook and all that. Now you are giving all these things. Yeah. Yes. And any suggestions for the upcoming sessions? Shanmuga will post a small notice, right, regarding the discussion group. Yeah.
Yes, Father.
And yeah. And any other suggestions for the upcoming sessions? Those active group members can suggest. We will take up those sessions, whatever you want.
Can you take, please, speaking and writing one session, Father?
Yeah. Yeah, they will do it after that 1 or 2 sessions once we complete what they have sent already, the clarifications about B and C. After that, we will do it. Yeah. The problem is for reading and listening, if you keep live session, not even 5 members will be there because all the institutes are teaching reading and speaking and writing. So most of them may not attend. That was the problem. That's why every time the batch will come out almost off with the speaking and reading. It will not reach the end. Yes. Speaking, even you have clear explanations by tutor. Still, she is an interlocutor at Ernakulam. That what is her name? Mary Paul. Something like that. She has explained literally. She is an interlocutor. Since she got warnings not to teach, that's not allowed actually. She has stopped now. Otherwise, she was teaching only in our platform. We have recordings of that, what to be done, how it to be handled, all those interlocutor teaching. She is also a good teacher. Yes. I think things are done, right? Shall we stop?
Yeah. Yes, Father.
Okay. See you again. God bless you. Keep
Thank you so much.
encouraging others also. Yeah, and even those who are in the active discussion group, encourage other members, posting what are the benefits of joining a real discussion group and all that. And like you can, Shanmuga can also include, maybe if you have fixed the time, you can include task will be posted at this time and discussion will be at this time. And materials, task and materials
By
will be
this
posted.
second, we'll ask friends first for the.
Yeah. And ask them to suggest their timing.
Yeah.
Okay. Like probably you can ask for UK timing, okay? That will be better.
Yeah.
Hmm?
Okay.
Yeah. We'll focus on that because already in India timing one is going on, right? And we will see because there are so many UK people now. You ask for UK timing, they can suggest the timing when they respond. Okay, and the people will not be and in between people will not be allowed to join.
Okay.
The group will go straight away with the people who are starting with. Okay, smile and go. Bye-bye. God bless you.
Thank
Thank
you.
you,
Good night,
Father.
Father. Good night,
Thank you very
Father.
much.
Thank you, Father. Thank you.
Father.
Thank you, Father.
Thank you, Father.